By the time you are watching this video, you already know that there was a woman in Kenya who died because of liposuction surgery. That is what I'm going to talk about. Complication. I know he died because of complication that came after, and most of the time when you're going for this procedure, people are just after money. Those, the people who are in business, or the doctors who are in business, or the doctor who are performing the procedure, are you are trying to think that maybe afterwards you will look good. Of course you will look good if the procedure succeeded, but you don't know, or you are not aware of complications that might set in after the procedure. So those are the things we are going to talk about, so that you know the most important thing. Listen, I'm going to talk about a lot of things in this video, but the most important thing that you have to know, or that you must listen to, is about the complication that might come after liposuction surgery. So guys, if you have not subscribed, sit down, relax, subscribe, like the video, share, comment. Don't forget to turn your notification bell, so that every time I post a video, you will be the first person to be notified. So guys, you let me now stand up so that I give you what the goal is, to get the beauty or the outlook. I don't know who you are doing this for. I hope you're doing it for yourself. But do you know the complications? So let's look the overview, everything about this liposuction. So what is liposuction? Liposuction is a cosmetic fat removal procedure. It can permanently remove fat cells that store fat uh, from a particular section of your body that you want to improve. So liposuction help get rid of fat deposit that do not respond to diet and exercise. Yeah. So other name of liposuction is lipo. You might, or you have, maybe you have ever heard people talking about lipo. Lipo is liposuction, another name of liposuction, or lipoplasty, from the plastic surgery. So where on your body can you get liposuction? You can have liposuction procedure anywhere on your body where you have deposits of fats. Some of the most common area of your body include the abdomen, the stomach, or the waist, the hips, of which people rarely remove fats from their hips, the back or the chest, the face, the cheeks, the chin, or the neck, the butts, the inner knee, the ankles, the thigh, and the upper arms. Here, yeah. Who is a candidate of a liposuction? Candidate of liposuction should meet certain requirement to make sure their procedure is effective and safe. So candidates who qualify for liposuction procedure include adults within an average or slightly above average weight. Yeah, people who have firm skin with elasticity or high in the elastin protein and a good muscle tone can also be a candidate of liposuction. Adults who have good overall health also can be a candidate of liposuction. People who have pockets of fats that does not respond well to diet and exercise, non-smokers, because in this video we're going to see where if you want to do liposuction you should stop smoking. So non-smokers are also candidates of liposuction. People with a realistic goal of the outcome of the procedure. So these are common qualifications that healthcare provider evaluate before procedure, before recommending you to treatment. So your provider will let you know if liposuction is right for you or not right for you. So who might be a candidate of liposuction? Certain factor could cause liposuction procedure to be unsuccessful. Who might not be, I'm saying who might not be, not who might not. Who might not be a candidate of liposuction? And we are saying certain factors could cause liposuction procedure to be unsuccessful or poses a threat to your overall health. You might be a candidate for liposuction if you might not be, sorry for that, you might not be a candidate for liposuction if you're underweight, if you're slim like me, if you're petite like me, if you are not a candidate of liposuction. You might not be a candidate of liposuction. If you have BMI over 25, go and Google BMI. What is the meaning of BMI? I will not tell you everything here. Some of them you will go and Google and see what is the meaning, or the meaning of whatever I'm trying to say. But if you have a BMI of 25 and above, you might 25 and below, you might not be a candidate of liposuction. If you have a size life-threatening conditions that can make your healing difficult, like diabetes mellitus, you will not be a candidate of liposuction. If you have unrealistic expectation for the procedure, girl, you are not one. If you have a poor skin quality, girl, sit down, relax, and enjoy eating your things. Liposuction is not for you. So liposuction alone can improve saggy, loose skin. Yeah, get it right. Liposuction alone cannot improve, cannot improve a loose, saggy skin. This is common after significant weight loss. So you get it? If your goal is to get rid of loose skin, your healthcare provider might recommend a liposuction along with excess skin removal. So you get that those who are overweight, if they get liposuction, then after healing, the doctor will recommend for excess skin removal, or maybe during the procedure they get remove some skin that are necessary. Another question that you might not, or you might want to know: can older adults get liposuction? Age usually is not a factor that a provider need to consider when discussing liposuction. However, people over age 25 years and above, their skin are less firm or has lost too much elasticity, so they might not need it. Yeah, they might not need it, or the doctor will not recommend such person to do liposuction. Can men get liposuction? Yes, everyone in this world can get liposuction. People of any sex, can get liposuction, men, women. For men or people assigned male gender at birth, healthcare provider may recommend liposuction to treat some types of gynecomastia or enlarged male breast tissue. You know, if you are a man and maybe you have boobs, your doctor can recommend liposuction for that case or for that condition. Why are liposuction done? You might consider having a liposuction procedure if you tried dieting, like I'm trying to diet right now. You might consider this procedure, or you might consider having a liposuction procedure if you've tried dieting and exercising for several years and certain area of your body does not respond, or refuse to respond, or refuse to shrink. Yeah. Also, if you want to smooth out fat bubble of your body, you can go ahead. If you want a permanent body disfiguration, or this dismantlation, or this whatever, or demodification. If you want a permanent body demodification, girl, you can go for it. This procedure is mostly for ladies. Ladies are the people who are usually not, and they're usually uncomfortable with their body. So instead of someone going to the gym, some people go for short what? They prefer shortcuts, so they will prefer this procedure. Men, you've only heard if they have maybe enlarged breast, and the doctor might recommend it. Yeah, the doctor might recommend it so that they remove excess fats from the breast. Also, if you can dedicate 4 to 6 weeks for your body to recover after surgery, you are supposed to go for it, or you might need it, or it can be done. So after the surgery, you have to consider 4 to 6 weeks for your body to recover. Because after this video, I'm going to show you the procedure, how the procedure is done, and you will regret doing it, or you will not want to do it because you heard people doing it. You will be more comfortable with that your body, because there are a lot of complications after this procedure. So after this video, make sure you watch this video up to the end, and then the next video I'm going to attach the procedure, how it is done, so that you can decide if you still want it or you don't want it. Can liposuction help with obesity? Because I'm only trying to help some of the questions that I saw people asking. Liposuction is not a weight loss solution, and it doesn't treat excess weight or obesity. Most people choose to have a liposuction procedure to remove unwanted fat from certain part of their body. Liposuction is not a fully body weight loss method. Yeah, so remember, if you're obese, sometimes you have fat deposit from the heart to the lungs, liver, whatever. So do you think liposuction can be done inside your heart? No, it cannot be done. So it is not a procedure for weight loss. So even if you are considering going for liposuction, you must consider doing exercise, dieting, so that you get a weight loss of the whole body. Okay, so liposuction is not fully body weight loss method. While the treatment is permanent, your body can regrow fat. The procedure is permanent, but your body can regrow fat where you had removed it. You think you have gone for liposuction to remove fat from your belly, that it is now done deal. Your body can regrow fat, especially if you're not eating healthy, especially if you're not doing any exercise. Yeah, your body can regrow fats. Everybody is unique. You might follow a nutritious diet and exercise regularly, but still have trouble losing weight. If you have excess weight, so talk to your healthcare provider about weight management treatment option to help you reach your goal. How common is liposuction? Liposuction nowadays is really common. Even in Kenya, we have heard that our girl died out after undergoing this procedure. The procedure is very expensive, so you can even try to do another method, or to do exercise, dieting, and then get the goal that you reach the goal that you want. I know the goal is to look good. You have a figure 8 shape, so you can consider that. So it is common from different parts of the world, and therefore it is very common. So just know it is common. Another thing that I want to talk about, what are the types of liposuction surgery? There are different types of liposuction procedure available to meet different goals of the treatment. Different types of liposuction include tumescent liposuction. Tumescent liposuction is the most common liposuction procedure. Your surgeon inject a saline solution into the fat area. The mixture contains medicines such as epinephrine, which shrink your blood vessels, and then this solution helps your surgeon remove fat easily and reduce blood loss. Other medications are sometimes included to provide pain relief. Also, we have another procedure or another type, that is ultrasound assisted liposuction. Your surgeon uses ultrasound energy via a metal rod procedure underneath your skin or underneath your skin to liquefy your fat before removing it from your body. We have vibration application of sound energy at resonance liposuction. This is another type, uses a stainless steel tool with gloves and ultrasound waves to easily break down and remove fat cells and fat from the body. And this this is a type of UAL. Go and Google and see what it is. We have suction assisted liposuction. It's a traditional form of liposuction that uses a vacuum to remove the fat from the body. And we also have power assisted liposuction. Power assisted liposuction uses small stainless steel tool that remove back and forth over your fat to break it down. The cannula makes removing the fat easy for your doctor, and the procedure is more precise. Not anybody can perform liposuction. A nurse cannot perform liposuction procedure or surgery. Neurosurgeon cannot perform liposuction surgery. A plastic surgeon doctor is the one who is capable of performing this procedure. And you get that most people who get a specialist or this plastic surgeon doctor, they usually do what? They usually recover very fast if they get a specialist. Yeah, not everyone, not every doctor, not every nurse, not everyone can perform liposuction. It is specifically for a surgeon doctor, yeah, or a plastic surgeon doctor is the one who is capable of performing this liposuction. What happened before a liposuction procedure? Before your liposuction procedure, you'll meet with your surgeon. During this consultation, you'll discuss your skin type, which liposuction option is best for you, the effectiveness and safety of the liposuction procedure, the realistic expectation of the procedure, the cost, any other question, concern you have, you will discuss that. And for the procedure also, before, you need to stop smoking, get lab tests, take or avoid certain medications and vitamins, follow dietary or alcohol restriction. Some people get liposuction and still smoke. Hey, you guys, you will get what? Another question that is also, I'm trying to get those questions so that I can answer them. Another question that is also asked multiple: can I get liposuction or plastic surgery procedure at once? You mean you want to get it from your face, under here, under the thigh, from the stomach, yeah? If you are interested in other body contouring or plastic surgery procedure, talk to your surgeon and he will advise you on what you will do at once. I'm not here to advise you that you will do them. You will go for the stomach reduction of the stomach. You also go for removal of fat from other parts of your body. No, I'm here not to advise you, but talk to your surgeon, talk to your plastic surgeon doctor, so that he or she can advise you what are the best thing that you can do. Yeah, what happened after liposuction procedure? After your liposuction procedure, your healthcare provider will talk to you about how to care the surgeon site, the surgical site, not the surgeon site, the surgical site, medication that you need to take to heal faster, and also to reduce pain. You will do a follow-up appointment, complication watch out. Yeah, you will. So yeah, those are the things that your doctor will talk to you about a liposuction. Now, the last thing that is so important that I want to talk about now is the risk and the benefits. I know the benefits you already know, because most of people usually go there because they want to look nice. So what are the benefits of liposuction procedure? The benefits of liposuction procedure include a solution to remove a stubborn area of fat from your body that don't respond to diet and exercise. Also a smoother body shape to your clothes, fit better. I mean, let me say that now you will get that shape that you want, and then your clothes will fit you better. And also minimal amount of scarring after the procedure. Those are the, because you get that they insert that whatever. I will show you the procedure so that you get to know what usually happen during the procedure. Now, the risk. What are the risks? And when you are going for this procedure, make sure that you know the risk. Every surgery, not every surgeon, every surgery comes with the risk. Liposuction has a good safety record. The risks are limited when you choose a trained board certified plastic surgeon. Smaller area of fat remove involve a shorter procedure with fewer risk. So although we have some rare risk that might come, number one is infection. If the procedure, you are getting inside your body, the doctor is getting inside your body, so if the septic technique is not followed, then you will get infection. Before and after the procedure, you have to get antibiotics to prevent you from getting this infection. So infection is number one. We also have skin discoloration. Some of the drugs that are used during the procedure can cause skin discoloration, or during the procedure, the scars, whatever, the scars that will come after the procedure can cause skin discoloration or changes in the skin sensation. Yeah, you tampered with a lot of nerves. Yeah, the doctor might tamper with nerves, yeah, in your on that part, or at that part, or in that part, yeah, in that part where they're doing the procedure. Also bruises can set in, swelling, or poor wound healing, especially maybe if you are somebody who doesn't you don't have strong immunity. Poor in healing will set in, pain and discomfort until the surgical site get healed. We have scarring. They're cutting the skin to get inside to remove the fat, so scarring might set in. And also even inside your body you can get scars. Bleeding, which is also common, contours, deformities will set in. And the last complication is death. You might die. Yeah, you might die. So those are some of the complications that might set in when you've gone for this liposuction procedure. Yeah. Anything else, kindly ask in the comment section. I will talk about it. Guys, if you're not subscribed to this channel, I don't know what you're waiting for. I don't know which channel you're going to subscribe to. So kindly subscribe, like the video, share, comment. People like entertainment more than educational content or educative content. Why? Because you are mean to yourself. Yeah, to yourself. I'm not saying entertainment is bad. I'm not saying that. I'm only saying you should consider both of them. You should get educative content and also entertainment, and you get empowered, and you get, yeah, girl. Bye till next time. Let's meet in the next video. Yeah.